Hello and welcome back to In Time TV's On the Edge. Conversations in Cardiology. It's a subset of internal medicine. With me this hour, Dr. Janet Hayes and Dr. Joan Flanders. And we were, before the commercial break, talking about some of the specializations in cardiology. I do want to pick up with that. Just to remind you viewers that if you're watching on a Saturday between noon and 1 o'clock Central Standard Time in the United States, you are watching a live broadcast, and you can join the conversation by sending us an email. We do have someone monitoring the email, ask@intimetv.com. If you have any questions, comments, any criticisms of what's going on, in any way you want to join the conversation, please do send us an email, and I'll be notified and handle your comments or question on air. If you're watching at any other time, you can tune in at www.intimetv.com 24 hours a day, 7 days a week, to check out archived broadcasts. So just to get back to the conversation, during the commercial break, in fact, we were talking a little bit more about how specialized cardiology has become. So since you were having that conversation, go ahead and pick up from there.
All right. Well, it's the way I explain it to my patients is it's almost like a menu. You can become a cardiologist by doing your fellowship training, and that gets you general cardiology status. Beyond that, you can get specialized training in imaging, and so you can go into the other imaging modalities, reading your own scans, as it were. You can also get specialized training in placing pacemakers, and you can become a physician that does that. Beyond that, there are some highly technical manipulations that you have to do with instruments inside someone's body, and that is a fellowship-trained specialty, both interventional cardiology as well as the electrophysiologic cardiology. And those are currently the two specialized fellowship-trained fields. However, there's mention at the American College of Cardiology level of making a third subspecialty in imaging itself, because the imaging alone, which we're going to talk about in a minute here, is getting to be very complicated.
Mm-hmm.
All right.
There's also heart failure is almost a subspecialty of its own now. Heart failure and transplantation medicine. On all these, frequently you will go get extra training beyond your 3-year fellowship, which is on top of a 3-year residency. So it's many years of training.
The bottom line is there's so much that we're learning that you can't know everything. And just like bankers subspecialize, and there's some benefit to that, a lot of medicine has become very specialized.
Indeed, and in fact, it's funny that we talk about that, because really the underlying premise, or the raison d'etre for In Time TV and these programs, is that you are an incredibly busy professional. You know, you can't read the 20 journals a month. You can't read all of the vendor emails and brochures. You can't possibly attend all the conferences. So, there's an opportunity to get snippets of information at your leisure about these various subjects. Plainly, this is going to be mission critical in the specializations of cardiology. So we do have some images to take a look at, the different kinds of procedures that you use in imaging and then in probably treating patients. Mm-hmm. Do we have a slide ready to go? Can we put up slide number 1? All right. So this is I guess the first slide we're looking at is a CTA. You want to talk a little bit about CTA?
Yeah, cardiac CTA has become
slide number 1, I think. Yeah. There we go.
A field where you can non-invasively, but with the use of dye, define the coronary anatomy.
Okay.
So in the past, the only way to look at the coronary arteries, because the heart is a moving target, was to actually put a small catheter up, thread it into that artery where the arrow is, and shoot dye into the artery so that you could actually directly visualize it under fluoroscopy, which is a form of X-ray. So shows up black against a white screen just like an X-ray, and you could see blockages. Cardiac CTA now the imaging is so fast that you don't have to stop the heart in order to visualize it. The scan stops it by imaging it very quickly. So you can actually get these very pretty pictures. We used to be able to do this, but they would be a blur.
Okay.
Because of the heart's movement.
So is there another? I think slide 2 is probably another image of the. Yes. Okay. So there's another, and you described this to me before the show as a pretty picture, but perhaps not so diagnostic.
Yes. This is called a volume rendered image, and what the computer does is it gets all the data, and then it calculates what should be red, what should be white, and it basically colorizes it. So that this very much looks like a heart would look if you simply opened somebody's chest and looked down on top of it. The important, or where the action is, actually is inside the blood vessel walls. So for a cardiologist, this is a very pretty picture. We can point to things, we can show patients where blockages are. But what we really care about is how significant the blockage is. So we want to quantify things, and that's really best done with the raw data.
Okay, so let's see. I think the next slide, let's see, Dr. Hayes, that's...
So this is actually an injection. This is actually dye going down the coronary artery, in this case the right coronary artery,
okay,
which is the long white stream.
All right.
And in this case there are no blockages, and in fact this is, the computer can manipulate the images to straighten it out for you so you don't see any of the kinks in it. And this looks very pretty. When it is good, it's very good. There are some problems with it. You have to make sure there's no motion at all, and calcium will get in the way of a good picture. But when it's good, it's very good.
And let's see, and speaking of calcium, let's see, the next slide is...
This shows what calcium does.
All right.
Calcium is very, very white, just like X-rays are very, very white of your bones. And there's a phenomenon called blooming. Now that's just a technical term, but basically what it means is that as the beams hit the calcium, they will scatter,
okay,
more so than they do through soft tissue, and so-called bloom or look bigger, kind of like objects in mirror are larger than they appear.
Okay. Well, before we go to the next slide, we are going to take a commercial break. This hour, you are watching Conversations in Cardiology. I'm Dr. JMoses. With me, Dr. Janet Hayes and Dr. Joan Flanders. Stay with us. We'll be right back.